If you're suffering from back pain during your pregnancy, you're not alone. But the good news is there are things we can do to help you to get out of pain while you're pregnant. My name is Dr. Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And both myself and Dr. Freedman have experience working with pregnant patients who have back pain. In fact, I underwent chiropractic care throughout both of my 2 pregnancies. Now, first of all, why is back pain an issue during pregnancy? Well, there's a few reasons. As the baby is growing, your posture starts to change. So as the baby gets bigger, then you start to get an increase in your low back curve or your lordosis, which can put some compression on the joints of the low back. And then further up, that can start to affect how the middle back or thoracic spine is sitting. Or perhaps some changes in the size of your chest are starting to pull your shoulders forward, and that can cause some tension or pain in your middle back. Also, there is a hormone called relaxin that gets released as your pregnancy goes on, and this is to help loosen up the ligaments of your pelvis. But that hormone doesn't only act on the ligaments of your pelvis, it acts on the ligaments throughout the spine, including the low back. So if you're starting to notice things shift in and out of comfortable positions in your body, you can thank relaxin for that. Now, sciatica is another issue that pregnant people sometimes face, and that's for a variety of reasons. It could be some of the postural issues that we talked about, but also if there's downward pressure into the pelvic floor muscles, and then the muscles that surround the sciatic nerve, like the piriformis, can put pressure on that nerve. Now, there are things that we can do to help you. We can work on loosening that piriformis muscle. We can realign your pelvis and take some of the pressure off of the low back if it's pinching some of the nerves that contribute to the sciatic nerve. Now, what's it going to look like if you come to us while you're pregnant for chiropractic care? We take some different considerations based on how your body is growing and changing. So mostly it's going to look pretty similar. We're going to use hands-on techniques to work on your muscles or to do spinal adjustments, or we might use the impulse tool, which gives a series of taps, or the activator tool. Now, I have used the activator tool sometimes on pregnant women when they're having pubic symphysis pain at the front of their pelvis. Sometimes this can become misaligned, and we can use the activator, which just does a single tap, just to realign that and take some of the pain off of that. Now, just like if you're not pregnant, any treatment choices that we make are made together. So if something doesn't feel right to you during your pregnancy, we don't have to use that treatment. And adjustments might end up being a little bit more gentle because, again, of that relaxin hormone. Things move a little easier. We don't have to convince your body so much to move in the direction that we want it to. Although back pain is common during pregnancy, you don't have to suffer for those 9 months. There are things that we can do. Chiropractic is safe and effective through all the trimesters of your pregnancy, and we're happy to help you get out of pain and get back to enjoying your pregnancy. We post regular content under Willowbrook Chiropractic on Instagram, Facebook, and YouTube. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Armstrong, or Dr. Jody Freedman. You can book online at willowbrookchiropractic.com.